Our team has an emergency preparedness plan that we put in place to address a number of different types of emergencies. That plan could help us in any situation from a weather emergency to a natural disaster to a pandemic such as this. We've actually been working through that plan for some time, so the declaration of an emergency doesn't change those things today. Our emergency preparedness plan focuses on ways for us to provide care to as many patients as we need. The steps in that plan will address things like bed availability, nursing and physician staffing, the demand of patients to come, the number of patients in the emergency room, our ability to test. All of those things play into the plan. Today, we are preparing for a large number of patients that might need care, but we have no capacity constraints at the moment. That emergency preparedness plan does allow us to significantly increase our capacity to take care of patients in our hospital if we need to. So at this point, there's no limitations, no capacity constraints. There's a spectrum of severity of illness associated with this disease. Just like some people will be able to be treated and cared for at home, there's a spectrum of hospital care that will be needed, and many patients that need hospital care will be able to be cared for at any hospital, that the hospital that their primary care provider may work at on a regular basis. There will be others, though, that will need services that only an academic medical center can provide, and it's important that we are able to provide those services when called upon. Facilities that offer different services obviously have different levels of emergency preparedness and different plans. And so we are having daily touch points around the emergency plan for each of our facilities across Greater Kansas to coordinate their actions with those here in Kansas City. So if you have symptoms, fever, headache, cough, runny nose, please contact your primary care provider, your healthcare provider first. Have a conversation about what testing is appropriate and necessary. In most cases, that will start with ruling out the flu. So we work very closely with city and county governments, health departments, EMS departments, and other hospitals and health systems across the city. The Mid-America Regional Council has a coordinating group specifically around healthcare and around emergency management, and we've been meeting or talking with those groups on a regular basis as well. It's possible that as the situation unfolds and circumstances change, that we may make decisions that do change the way visitors and patients experience their time here. Primarily in an aim to protect patients that are in our hospital, to limit the spread of disease from the community to patients and staff that work here, and to provide and protect our ability to provide care for anyone. It is possible that a state or federal declaration of an emergency or disaster can change the way that we are able to take care of patients. For example, it's likely that the use of telemedicine will be expanded to provide care for patients who might not be able to travel or whom we might not want to travel. And those sorts of things, I think, will be the immediate impact. We are collecting specimens from patients in the hospital or from patients in doctors' offices or other clinics across town who need to be tested. We are not running those tests. The actual testing is being performed today at state health department laboratories. We do anticipate in the next week or so the ability to work with a local laboratory to run tests for us that we collect here. And it's possible that in the next weeks to months, we would be able to run tests on site in our microbiology laboratories. Testing takes somewhere between 6 and 18 hours for a result to come back. The labs running the test for us need about 6 hours of time once the specimen is in the lab and on the machine. And the time to get it there and results, or provide us with results, could lead to a larger time window. So when my friends or family or patients ask what's important for me to do, I answer with wash your hands, don't touch your face, sanitize and clean frequently your horizontal surfaces, don't come to work if you're sick, And if you have questions or feel you need to seek care, call ahead. We have a great team here who works very hard every day to take exceptional care of patients. And I've been out and talked with them and know how they're feeling and what they're doing, and they are prepared. They are ready to do whatever is needed to provide that same great care for our patients, whatever the circumstance or situation.
Ready for no question?
fill out, and